Some of these incidental findings has serious implications. In this case, once we scroll chronally, you can obviously see the enlargement of the right inferior concha. It has a heterogeneous mixed density, which looks like consistent of areas of soft tissue density and also surrounded with areas of granular bone density. However, if you look more superiorly in this patient, in the area of the posterior ethmoid cells on the right side as well, you can see another granular bony region affecting the right ethmoid sinus, also affecting the floor of the anterior cranial fossa, specifically at the cribriform plate, also affecting the crista galli. And of course, this area that contains the olfactory fossa, where we have our olfactory nerve. It's interesting because we see this on the inferior concha, which is a separate bone. It doesn't actually belongs to the maxillary bone or the ethmoid bone. These lesions looks like they are coming from fibrous-origin. For your knowledge, the inferior concha is a separate bone. It doesn't belong to the maxillary bone or the ethmoid bone. So in this case, we have two separate bones affected by a fibro-osseous lesion, which is the inferior concha on the right side and also the roof of the ethmoid sinus and the cribriform plate, which is part of the ethmoid bone. So this will affect our differential diagnosis, which could be something like fibrous dysplasia, but now it's affecting multiple bones. So we should consider polyostotic fibrous dysplasia, but also we should give recommendations about the olfactory bulb and that patient might in the future has implication related to the smell sensation, and that should be actually followed up radiographically and clinically.